Welcome back. Well, today I am joined by Dr. Hovanesian, and he is with Harvard Eye, and we have our Zoom thing going on. Well, welcome. How are you?
I love it. It's great to see you, Lisa. You look terrific for somebody in a pandemic.
Oh, well, so do you. So we're doing something right. Maybe we're not letting the whole fear and scariness of this affect us, because that certainly can be, something of concern.
That's
but nonetheless, what is it you are doing these days?
Well, on the personal front, I'm trying to keep active because I think that's important. And doing it, in these conditions is harder than normal because not all of our normal facilities are open. Right. But the outdoors is beautiful, and on most days we're having great weather, so I'm getting out and exercising. And thankfully I have my wife and my kids to do that with me. And so on a professional side, we are trying very hard to take care of all our patients because we're blessed to have so many, and we're doing that. And increasingly, we're doing that in new and novel ways, like video conferencing.
Right. Well, it's interesting. Like if I get really close, could you even see my eyes?
We ophthalmologists are used to our microscopes and our data and all of that, but it's actually amazing how much we can do by looking exactly as you just showed. I'm getting good at telling patients, okay, look up, okay, look right.
Oh my gosh.
Feel the eyelid open. But and it's particularly important now because we're seeing a lot of people who are having difficulty with environmental stuff affecting their eyes. I don't mean entirely COVID, but people are worried about that. Does COVID affect the eye? And it can. And people are more commonly, though, suffering from allergies and dry eye, the two commonest ones we deal with here in Southern California.
Right. So would you say that obviously the allergies is an obvious situation, but the dry eye, let's talk about that. So people are looking at their computers a whole lot more.
Yeah. Great point. So screen time definitely drives dry eye symptoms because when we are watching a screen, we don't blink as often as we normally do. And so that means there's more drying of the surface of the eye. Our diets may not be quite as good as they normally are because of we're trying to limit our trips to the stores. And so eating the fresh things that we do, we may not be doing as much. And then of course, allergy is driven by environmental conditions. And look what we've had. We've had periods of rain followed by periods of gorgeous sunny days like it happens to be today. And what does that mean? It means things are blooming and the allergy, producing pollens are in the air. There's dust, there's mold. When the wind blows from the desert, we have that. So environmental stuff, allergies and dry eye are in full bloom in this springtime.
Right. Now, you mentioned that coronavirus ocular symptoms. Are you referring to the things we just mentioned, or there are some specific things?
There are some specific things. So the coronavirus is a virus like a common cold virus, but this one particularly targets the respiratory system. Right. What makes it unique is, like many viruses, it can affect the eye. It can actually cause a pink eye, a viral conjunctivitis. This is important because we've had a number of patients who've read about this and are fearful when their eyes are irritated or sensitive that they have coronavirus, when in fact they have common allergies or dry eye problems. Mm-hmm. And so I have a picture of coronavirus, and what you'll see in a typical viral pink eye is a very red eye. The eye looks beet red. The blood vessels are really swollen in a way that you wouldn't mistake for being something minor. Often there's an accompanying interesting symptom you can help diagnose yourself by feeling. Right in front of the ear, we've got a lymph node that normally you won't feel it at all, right in front of your ear. So like right from the ear canal, straight in front of that, in that area, if you feel along the side, sort of where your sideburn would be if you're a gentleman, you can feel a swollen lymph node that is often a little tender if you're having a viral infection around your eyes. You won't get that with allergies. You won't get that with dry eye symptoms. That's a very specific way you can diagnose yourself if you have a viral pink eye. If you're concerned about what's causing uncomfortable eyes, we're happy to do virtual telehealth visits just like this. Okay. And our office is available to do that any day. And so we're happy to do that. And you can do it right from the comfort of your home. You don't need a special software. It is helpful to have a phone, any type of smartphone, Android or otherwise, with a camera on it, but
Okay.
most of our viewers have that. And we can do a pretty good job diagnosing these kinds of things.
Now, we were talking to some other doctors earlier, and they're talking a lot about the teleconferencing now that's sort of coming out of all of this, and it's
Yeah.
really been quite popular, as you know. Obviously, we're doing
Yeah.
it here. But how do people know that, like, if they visit you, is it an insurance thing, or how does that work?
Well, thankfully, the federal government, got right on this, and so they put in place some rules that allow you to use your insurance for a video conference with your doctor, just like
Okay.
you would if you're coming into the office. And
Okay.
so, it's as easy as that. We don't want anybody to get surprises on the cost of visits.
Right.
But now your insurance, whether it's Medicare, whether you have a supplemental, basically we have, they put in place some codes that can be used to bill them for your services.
Okay.
If you call or you email appointments at harvardeye.com, works for, by email, or the phone number is 949-951-2020. Either way you contact us, you can talk with the staff about how that works.
Okay, great. And then one last thing, I did want to talk about the pink eye, because pink eye, it isn't just a coronavirus thing. It can be a variety of things. How do you get it?
Well, pink eye is, you get it just like you get the common cold. And the most common way is what we're learning through our hands. Washing our hands is what prevents it. Thankfully, a lot fewer people have common colds right now because of all the hand washing we're doing, all the social distancing helps with other less lethal viruses. So if you have, upper respiratory cold, cough type symptoms, and you have a red eye, whether it's coronavirus or another one, probably you have pink eye. But we can help diagnose that even with telemedicine. And I have, just for contrast, I brought a picture, I shared a picture with you of what more allergy looks like. The most common type of allergy we're seeing is on the eyelids. It's almost like eczema on the skin. You'll see around the eye, the eyeball itself is not that red, but on the skin around the eye, there's a roughening that looks almost like alligator or snake skin that is kind of telltale that allergy is playing a role. And of course, the thing about allergies is itching is a prominent symptom. If it itches, it's probably allergy and not an infection.
Now, are you able to diagnose, obviously you can diagnose the problem technically over the teleconferencing. What about a prescription? Can you still get them a prescription?
You bet. Yep. And that's exactly what we need to do. And of course, most pharmacies are delivering now, so you don't have to leave home. And I believe many of them are doing it at no cost, although obviously call your pharmacy. We always try to prescribe less expensive medications. There are some over-the-counters as well you can order for delivery where that's possible. Yeah.
Good. Well, thank you so much for the information. I appreciate it. Hopefully we'll be done with this stay-at-home thing and they'll start letting people come out and do their thing.
Lisa, it's a challenging time for everybody. Keep a positive attitude. That's really important. Get up, move around, and try to be as normal as you can is my best advice just as a doctor, because we'll get through this. And on the other side, we're going to have probably some newer, better habits for taking care of ourselves if we do the right things. So thank you, Lisa. You've been working especially hard these weeks to keep the community informed. Everybody really owes you and the whole crew there at the TV station at Channel 6 a thanks for being there for your community. I'm grateful, and it's a pleasure as always to work with you. So,
all right. Well, thank you so much. You stay healthy out there.
Thanks, you too.
All right. Thank you. And we'll be right back after this.